acute cervicitis. Next to the urethra, the cervix is considered the organ most frequently infected by gonorrhea. There are two reasons for this. The cervical mucosa is columnar in type, therefore especially prone to gonorrheal infection. And secondly, during coitus, the seminal discharge is poured directly over or around the cervix. In a large percentage of cases, the cervix and urethra are involved at the same time. It is rare to see a gonorrheal cervicitis without a urethritis, but the reverse is not true. Symptoms. There is generally a sense of fullness or weight in the region of the vagina and a discharge. If the body of the uterus is involved, there may be considerable pain in the hypogastrium. Examination. Examination shows the cervix much reddened and covered with more or less purulent discharge. A smear usually shows the gonococcus. On wiping away the discharge, the mucous membrane may show bleeding points or erosions, and the cervix may appear edematous. Diagnosis. Diagnosis must be made from the ordinary form of cervicitis, such as is found with a laceration of the cervix due to childbirth, or cervicitis due to passive congestion, as in certain displacements and stenosis of the cervix. Carcinoma of the cervix is differentiated by the examination of excised portions of tissue in doubtful cases. Involvement of the mucous membrane in any of the exanthematous diseases can be differentiated by the presence of other symptoms. Syphilitic mucus patches can also be excluded by the history and clinical findings, although these cases are sometimes very puzzling and a double infection may be found. The same is true of chancres and chancroids. The finding of the spirocheta pallida or the bacillus of Ducret may establish the diagnosis. Treatment. Some physicians are averse to douching in the most acute stages of cervicitis, as they claim that there is danger of negating the value of the acid secretion of the vagina, which is a natural safeguard. If the cervix is actually involved, it seems, in the opinion of the writer, better judgment to keep mechanically removing the constantly accumulating discharge than to allow it to remain in contact with both the affected and unaffected mucous surfaces. Therefore, copious hot irrigations of a mild antiseptic solution are advised under low pressure so that there shall be no driving of the discharge farther up into the cervix. Boric acid solution, 2%, Lysol, 1%, bichloride of mercury, 1 to 5,000 to 10,000, permanganate of potassium or creolin, 0.5%, are used. These irrigations should be given 2 or 3 times daily or oftener if the discharge is very profuse.